Dear delegates, colleagues, partners and patient representatives, thank you for the invitation to contribute to today's important symposium, United Against Sepsis. Sepsis remains a major public health challenge across the WHO European region. It affects millions each year, many of them children and older persons, and continues to cause avoidable deaths and long-term complications. With more than 3 million people affected in the European Union alone, the burden is high but not inevitable. We know that timely recognition, appropriate treatment and coordinated follow-up care can significantly reduce harm. Yet progress across the countries remains uneven. In a resolution adopted in 2017, the World Health Assembly urged countries to integrate prevention, diagnosis and treatment of sepsis into their national health policies. But today, only 8 countries in the WHO European region have developed national roadmaps to address sepsis. But this is just the start. We need more countries to develop comprehensive sepsis strategies and ensure those strategies are being put into practice. The gap between planning and action must be closed. The European Union has the potential to leverage a broader and more coordinated effort to fight sepsis. Under the EU Preparedness Union strategy and building on the recently adopted EU strategies on medical countermeasures and stockpiling, the EU has a unique opportunity to significantly strengthen the prevention, early diagnosis and clinical management of sepsis across its member states. In that sense, I support the call made earlier this year by the European Sepsis Alliance and other organizations to develop and implement a European sepsis strategy and plan. The national roadmaps must be integrated across all levels of the health system, linking primary care, emergency medicine, antimicrobial stewardship, maternal and child health, digital health and critical care, among others. Always including patients, survivors and their families at every single step. At WHO Europe, we are ready to support countries in this work. From policy guidance to implementation tools, our role is to help translate evidence into action. National leadership remains essential. Today, I urge all countries in the region to develop or update a national roadmap or initiative to reduce the burden of lethal sepsis. Move from planning to implementation with concrete timelines and actions. Strengthen data systems, clinical training and public awareness. Engage with patients, families and professionals as full partners. Sepsis requires a whole-of-system response. There is no single solution, but there is a clear path forward. With commitment, coordination and urgency, we can reduce suffering and save lives. Thank you for your dedication and for keeping this issue high on the European agenda.